about the all-important health sector. Well, literally all sectors are important, right? If you're not buying petrol for your car's health, you're going to the hospital or trying to maintain your health by eating right. But the health sector in Nigeria is clearly one that needs a lot of investment, a lot of attention. We can talk about JAPA all day. We can talk about the equipment remuneration all day. We can talk about the primary healthcare sector all day, not to talk of secondary and tertiary. This morning, let's try to pick some of the important issues in this sector in terms of universal health care coverage, which means that everybody should have some semblance of health care accessible to them in terms of the cost and, of course, proximity. We have joining us the Director, Basic Healthcare Provision Fund, Federal Minister of Health, Dr. Mukhtar Mohammed, joins us virtually on the program this morning to walk through this all-important conversation. Dr. Mohammed, you're welcome to the Morning Brief.
Good morning. Thank you for having me.
Well, there's a lot of talk about petrol, and rightly so, and that concerns the health of the economy of our vehicles, generating set and all. But let's talk about our health for a moment. And there's been this back and forth, and I'd like us to start from there as to, so what happens to the primary health care facilities across the country? With the financial autonomy granted to local government, there's a primary healthcare development authority, and there are different levels across states as well that are responsible for primary healthcare. So before we talk about access and the cost, I think it's important to talk about what to expect now in terms of primary healthcare, which is the one closest to the people. You are in charge of at least the funding of this area. So from your side, how do you expect the implementation to go, particularly for the primary healthcare centers?
Okay, thank you very much. And good morning, Nigerians. So regarding the state of primary healthcare in the country, we have a very good understanding between the national and the state governments about how primary healthcare should be operated. The National Health Act provides that there will be a national body that comprises of both the federal government and the state government to operate the health system in the country. And in the primary healthcare strategy also, we have agreed with the states that the primary healthcare will be provided under our roof, meaning that everyone has his own responsibility. The federal government has a responsibility, the state government has a responsibility, and the local government with the current autonomy now has a responsibility and what they need to do. We cannot continue to have a fragmented health system where states will go in different direction, local governments will go in different direction, and the federal government also trying to steer in another direction. It has to be coordinated, it has to be one approach, and there has to be that understanding. And so far, under the leadership of the coordinating Minister of Health, we have managed to build on that strategy. He's in constant discussion with the governors and even the association of the local government to make sure that that understanding and that strategy is sustained, because that is the only way, if you have a coordinated approach, that will be able to succeed in delivering effective primary health care in the country.
All right, Dr. Mohammed, for context, I know that this fund was established under Section 11 of the National Health Act, which means that the fund is strictly for primary health care centers. And we know how important it is to improve that sector because people who are affected are those at the grassroots. But now permit me to say how these funds, 1% will be coming from the federal government, another percentage will be coming from international donor partners, another one will be coming from the private sector, which means a lot of fund coming into this purse to fund these primary healthcare centers. So the question will now be, how will these be implemented? How will the money be used to make sure that the goal is achieved? And of course, accountability and so many other issues around how this fund will be used. I know that you said there are gateways, which means there are already platforms set. So explain to us how this will be implemented and work.
Okay, so over the years, I think stakeholders in the health sector realized that there is a huge burden in Nigeria, in the health sector in Nigeria, as reflected by our maternal mortality, infant mortality, and under 5 mortality. These are the most important variables of measurement that show the health of the population. And the health sectors have pushed and worked towards having a dedicated fund that will serve as special intervention to improve the delivery of primary healthcare. And as you rightly mentioned, the Act was passed. Section 11 provides that the federal government will provide at least 1% of the Consolidated Revenue Fund, which will be used for this purpose to make sure that the primary healthcare centers are in a good position to provide service, to make sure that we have the required health cadre of health staff that will deliver these services, and to ensure that vulnerable population are enrolled onto the health insurance to have access to health services with very minimal or no out-of-pocket expenses. So the fund also has a provision that donors can also provide their funds, and also private sector can also provide their funds within this framework. And this fund is meant to be administered through 4 gateways, like you mentioned. These are agencies of government that statutorily provide certain functions. The National Primary Healthcare Development Agency, we know, is the coordinating authority, is the regulatory authority, is the one providing oversight on the national primary healthcare, the primary healthcare system in the country. They work very closely with the state government, who have established their own agencies, and also work directly with these health facilities to build their capacity, identify their challenges, and try to solve them. The second gateway is the National Health Insurance Agency, which really has the statutory function also to ensure that all Nigerians are covered by health insurance, meaning that Nigerians have access to health services at a very minimal resources. The third gateway is the emergency medical treatment. This is a committee that is under the chairmanship of a distinguished physician that also looks at medical emergencies. For example, we know one of the problems that responsible for maternal mortality is what is called the second delay. That is the delay after you made the decision to go to the hospital before you reach the hospital. So you need to fast track and also to facilitate access by providing transport and also engaging the community to ensure that a pregnant woman that needs to get to a hospital actually gets to that. So the emergency medical treatment provides this specialized service, the ambulance system, and working with the different categories of transport workers to make sure that this is divided. The last one is the Nigeria Center for Disease Control, which also has the statutory function for epidemic preparedness and response in the country. And a portion of that fund is also meant for them to react during epidemics. So in terms of the proportion of the funds, what we do at the BHCPF under the Coordinating Minister of Health is to distribute these funds. 45% goes to the National Primary Healthcare Development Agency, 48.75 goes to the National Health Insurance Agency, 1.25 goes to the Nigeria Centers for Disease Control, and 5% of the funds goes to the emergency medical treatment. Now, these responses are coordinated under what is called the Ministerial Oversight Committee and is chaired by the Honorable Minister of Health, and it has other stakeholders.
All right, Doctor, laudable ideas. But at the end of the day, efficiency and effectiveness is how we measure. So when I hear things like this, as brilliant as they sound, maybe if you put a chorus across to my village, I know whether this trickles down. Because there are 2 PHCs. If we use the PHCs, the primary healthcare urban PHCs, which have alternative to private hospital, but the one that has to do with literal survival, because there's little or no alternative, is the rural PHC. So before we begin to talk about how great this is and how distribution will be, can you give us maybe an empirical data of how it has been in terms of result that informed what is going on now?
Okay, so the fund, the act was passed in 2014. The funds become accessible from 2019 onwards, and the fund has been what I'll call steady, and we have seen an increase in the funds that are being made available. So these funds through the agencies are now utilized to first assess the primary healthcare facilities and then onboard them. And then they get accredited by NHIA. And then we now recruit vulnerable population who will now access services in these facilities. So back to your question, the empirical data is that the number of facilities have steadily increased, and the laudable idea of having one PHC per ward in this country has been achieved, I will say. We currently have about 8,300 primary healthcare facilities, which means one almost in every ward of the country is covered. And these facilities, some of them are not in very good shape, and therefore these funds are utilized to improve, the structure, provide the infrastructure, ensure that they have water, electricity, and also funds are made available to the facility itself to make decision in terms of buying the drugs that they need, in terms of using some money for fueling, money for transportation, and a lot of that. So we have classified the facilities into actually three. You have those that just are called primary healthcare facilities, but they do not have the required services. They do not have the right infrastructure, they not have the right human resources, and they not have the right equipment, to carry on with the services. These kind of facilities, some of them, have been enrolled so that we can move them forward. The second one are the ones that have some level of, efficiency. Maybe they have skilled birth attendants, up to 3 or 4. And then they also have dedicated staff, but maybe they don't provide 24-hour services. These are also enrolled on the BACPF. But our target is to make sure that all the facilities reach a level that is called L2. In L2, they have about more than 5 skilled birth attendants that can attend to patients that come anytime. They provide 24-hour service. And also they likely have like an accommodation, for the staff so that they can attend to pregnant women, in night. In terms of rural coverage, I'll say that it is widely spread. Like I told you, we have one facility now, almost one facility in every political ward in the country.
Right. So the challenge is really deep, and I'm glad we're talking about the rural areas. There's some centers that are decorated, painted, and pictures are taken, and people go to town with, oh, the government is doing great things. But some of those centers, when you go inside, you realize they don't even have equipment. They don't have beds and all of that, but people are big on just the outside. Talk more of what happens in rural areas. Some of them don't even have water. I know just recently there was some sort of award given to, I think, Adamawa State for providing water, something that basic. So you can imagine that this is a challenge, something as simple as providing water for primary healthcare centers in the country. So when you say that the goal is to get them to L2, I'd like you to give us a time frame. Again, that is what matters to a lot of people, because Nigerians can easily think now of the state of their primary healthcare centers, either in their village or the one closest to them, and wonder, when will this L2 thing get to us? So speak to us, time frame. How soon will this happen and be a reality, not just on the outside, on the inside, and in terms of manpower, as you said? How soon?
So, let me provide you with a little context. The Honorable Coordinating Minister of Health has focused his attention largely on reducing these very important and poor health indicators: maternal mortality, infant mortality, and under 5 mortality. These statistics have not changed in the last 20 years. And like you mentioned about the issue of fuel, or about the economy of a nation, The bottom line for population health is really these indices. No matter how good your hospital is, no matter how many specialists you have, no matter how advanced your country is, if your maternal mortality is very poor, if your infant mortality is very poor, and if your under 5 mortality and immunization coverage is very poor, health-wise, your population is not healthy. And Nigeria has been in the bad light globally, in terms of these indices. Therefore, what the minister did was to really galvanize the needed support to ensure that the state governors are enrolled. To make sure that the local governments are also on board. And he had this meeting, several meetings with the state governments. They have signed a compact that will ensure that we're all moving in one direction to make sure that everyone is having one plan, we're having one framework, and we're having one reporting system. That is very critical for us to address these issues of maternal mortality so that funds will be directed where they are necessary. In addition to that, the Honorable Minister of Health also has initiated a very strategic approach, which is quite laudable, something that has not happened in many years, which is to have all sectors, including the donors and private sector, to work in the same direction under what is called the sector-wide approach, which means that donors cannot, in the past, donors will just go to state, sign an agreement, and then start implementing their programs. Really, some of the programs not talking to each other, and the state governments also receive funds and they carry out their own functions. But now we are all galvanizing action to make sure that we work with one plan. As I'm talking to you now, all the states are working hard to submit what is called an annual operational plan. And it's based on that BHCPF and other resources will now be used to fund what are their deficiencies. So in that direction, I would say that yes, this is a very laudable idea, like you mentioned, and we're really working towards having a harmonized and uniform implementation process.
All right, Dr. Mohammed, before we let you go, I know that this somehow ties to the SDG 3 and SDG 10, which is about health and well-being and, of course, reduced inequalities, which means also that it's not just about the structure, it is about the personnel, those who will be working in these primary centers. Some of these funds that have been said will be gotten from the federal government, from private donors, and, of course, the private sector and international donors. Will some of that fund be channeled into training the personnel who will be the ones working in these primary health centers? We know how it has been over the years, where they don't even take their job seriously, and sometimes even when they do not have equipment or well-trained staff. How would you work to ensure that personnel becomes priority in this regard?
Well, absolutely. I mean, human resources for health or human resources for primary healthcare is very important, and in fact, it's one of the top items that is being addressed by this fund. We don't only provide funds for training. The National Primary Healthcare Development Agency has developed its own human resource plan to ensure that all primary healthcare centers covered by the by the Basic Healthcare Provision Fund have adequate and trained staff. So they also recruit staff based on ad hoc basis, pending when the time maybe the state governments or the local government can now hire permanent staff to continue to deliver that service. So as you mentioned also, there is a huge shift in terms of what the federal government can provide and what the state government can also provide. For them to access this fund, for the state government or local government to access this fund, they have to provide what is called 25% counterpart funding. So whatever fund is going to be sent to them, they have to make that available. I must admit that this has not been very regular, but henceforth the minister has determined that we will continue, with this, because it is a provision of the Act that the state governments have to provide that counterpart funding. And most of that counterpart funding will go into training, retraining, and also hiring of human resource for health to achieve the primary healthcare objective.
All right, you didn't quite answer my question on the time frame. They say goals are meant to be SMART, so specific, measurable, and then there's a time frame, they're time bound. So what is a target in terms of time frame to achieve L2 as we wind down quickly?
So, Shem, I may not be able to give you an exact timeline because we work on different trajectories. While some states like Lagos have advanced, and most of the facilities in Lagos State are in L2, there are many other states that the health facilities are not even in L1. So we have to work, and while some states require little or no support, most of the states require a direct intervention. They need technical assistance. They need to work hand in hand with the National Primary Healthcare Development Agency to be able to move them from one level to another. But overall, with the consistency of these funds, I see that in the next 3 years, we will be able to cover a substantial miles, to coverage within that period.
Well, we have to let you go now. I understand you have quite a schedule ahead of you, but I recall that there was a time you were briefing Nigerians on a daily basis. The presidential the task force on COVID-19. What a period then. And maybe sometime later we'll get a chance to sit down and talk about the learnings from there and how we've been able to improve on our healthcare delivery. But I'd like to thank you so much, Director, Basic Healthcare Provision Fund, Federal Ministry of Health, Dr. Mukhtar Mohammed. Thank you for your time and wish you the very best.
Thank you very much.
We'll take a moment now. When we return, Nigeria is on the verge of a new Chief Justice, and well, there are lots of issues on her table already. So we'll take a look at those issues and what you should be concerned about. Stay with us.